Okay, welcome everyone. We're live. This is our first town hall here in the city of San Mateo. I am your mayor, Joe Goethals, and I'm happy to have with me a group of people for a conversation today to hopefully answer all of your questions. The purpose and goals for today is to inform the local public about our response to COVID-19. We are all in this together. It's important to have the best resources and the best information. And my personal goal is for everyone to understand that we're all working together, that at all levels of government and all professionals in the healthcare profession are working together in this response to help the general public. With that in mind, and with these key issues that we will be discussing today, I hope to get to as many of your questions as possible. If you have a question, you can ask that question in the question and answer box, which should be at the bottom of your screen, and you can type or chat that question to us, and we will get to all of your questions. At this time, I want to introduce all of the speakers who are here with me today, all of the special guests. We have Dr. Greene, who's an expert virologist with the Gladstone Institute. We also have State Senator Jerry Hill, Assemblymember Kevin Mullen, the CEO of Sita, Roseanne Faust, the CEO of Samaritan House, Bart Charlo, our police chief, Ed Barberini, and our fire chief, Ray Iverson. Thank you all for joining me in this conversation. I want to start with Dr. Greene. Dr. Greene, can you tell me, what are we up against here? What is COVID-19 and how should we be looking at this? Are we doing enough? But first, what is it?
Well, thank you, Mayor. It's a pleasure to be with you and the citizens of San Mateo this afternoon. We are facing a pandemic caused by a virus called SARS-CoV-2 and the disease it produces, COVID-19, somewhat akin to HIV is the virus and AIDS is the disease. But maybe the best way for me to explain this is just to go through a few slides with everyone. So next slide, please. So coronaviruses. These are amongst the largest RNA viruses that we encounter. And there are 4 of them that account for 10 to 30% of the common colds we have every winter. And actually 2 of these viruses circulate in the summer and are often the cause of the common cold. But there have been 3 outbreaks of distinct coronaviruses in the last 18 years that are very different than the common cold. The first of these outbreaks was called SARS in 2002. Severe acute respiratory distress syndrome causes a deep-seated pneumonia in the lungs. This virus infected a little over 8,000 people and killed 774. There was a second outbreak of MERS, Middle Eastern Respiratory Syndrome, killed 858 but infected only about 2,500 people. And then in 2019, we have the emergence of COVID-19. Now there are 1.9 million people as of this morning infected and 120,000 deaths worldwide. So clearly, this coronavirus is spreading in a way that's very, very different from the other coronaviruses.
Dr. Greene, before we move on to the next slide, I want to ask a question that many people have been asking, which is, do we know enough about coronaviruses in general? Did we come up with a vaccine for SARS? Did we come up with a vaccine for MERS? Should we be hopeful that a vaccine for COVID-19 is coming soon?
A vaccine was developed against SARS, but it really, the virus disappeared from the population due to public health interventions before there was a chance to actually see if the vaccine worked or not.
And these 2 stats that you have here, the number of infected, that relates to how contagious the disease is, how easily it's passed the transmission from one human to another?
Yes, absolutely. And you can see that the infectivity of SARS and MERS were more limited than certainly than the SARS-CoV-2 that causes COVID-19.
Thank you so much.
Maybe we'll go on to the next slide. So these viruses are what are called zoonoses. And a zoonosis is a disease that comes from an animal. all of these coronaviruses that we're dealing with originate in the horseshoe bat. And the horseshoe bat transmits the virus. In the case of SARS, it went through an intermediary host called the palm civet, a form of a cat. In the case of MERS, it was the dromedary camel. And we don't know for sure. There was an original suggestion that the COVID-19 was coming through the pangolin. But there's been some debate about that. So I put a question mark there whether the pangolin is in fact the animal, the intermediary animal. That is the pangolin, if you didn't know, is a mammalian anteater, the most heavily trafficked, illegally trafficked mammal in the world. Next slide, please. We could go to that next slide.
Yep.
Thank you. So with no pre-existing immunity, so this virus likely broke into the human population in early December of 2019. No antivirals to check its growth and no vaccine to prevent us from getting infected. We're left with only the tools of public health to try and deal with this virus. And the keys to public health interventions are test, test, test. Figure out who is sick, who is infected with the virus, isolate those individuals, trace their contacts for potential quarantining, and in that kind of situation, society continues to function. But the key to all of this is having really good surveillance testing.
So I think, Dr. Greene, I think you just jumped ahead to a question that so many people are asking, and I've seen it asked already in our chat, and that is, what are the steps that need to be in place for us to reopen society? For people to go back to work, how many people would have to be out there engaging in this tracing process? Is that a question that I'm?
Yes, so it's okay. Going to, all right, so different places handle it differently. Contact tracing, for example, in Singapore, they're tracing contacts by Bluetooth technology on their phones. If someone becomes infected, you can detect the contacts that person had. So there are ways of doing it using digital types of approaches. But then the tried and true way is people start calling people, and they go and interview people who had interactions with the index case. So that could require hundreds, if not thousands, of people in a large metropolitan area to do this type of contact tracing. But it is key.
So we don't have that infrastructure for the tracing yet, and that's that infrastructure of tracing each contact and each new infection has to be in place in your mind before we reopen society.
Yes, I think we need some way of really being able to do that. This is our second bite at the apple. We had a first chance when the virus initially entered the United States, but we were not set up with the kind of testing that we needed to do this isolation and selective quarantining. So we were forced to go to a full mitigation, which is the rigorous social distancing, sheltering in place. Businesses are sheltered, schools closed, only essential services provided. Bad for the economy, very bad for the economy. But the spread of the virus can be contained. We've not only bent the curve here or flattened the curve in Northern California, we have actually crushed the curve in Northern California.
That's fantastic to hear. I know a lot of people are asking how well we're doing, and that is a good sign. And we'll get to a chart that shows that later. I do have an anonymous question right now about comparing COVID-19 to H1N1. You compared it to MERS and SARS because those are both coronaviruses, but would you compare it to H1N1 and some of the other flu viruses?
So H1N1 was the cause of the Spanish flu. 1918, actually it came in 3 waves. The Spanish flu killed between 20 and 100 million people. So no, this coronavirus pandemic, while serious, is certainly not as deadly as what many people refer to as the Great Influenza.
Thank you for that. So thank you for that comparison. Maybe let's move on to
we are in the midst of just what might be, hopefully it's just a single wave, But we certainly can't read the future with perfection for sure.
Well, and to that point, a lot more testing needs to be done, doesn't it? The rates that I'm seeing are that the number of people dying from this disease is still 3 or 4%. Does that actually reflect how deadly this disease is, or does that reflect that we're not testing enough people?
That's a very good question. I think there are a number of asymptomatic infections that are occurring, and so they never get counted as someone who was infected. So yes, the last time I did the calculation, I think worldwide it was running at about 5.4%. But I don't think that the death I don't think this virus will carry a death rate that high. I think once we figure out how many people are uncounted, I think it drops down more to around the 1% level.
If you don't mind, could you tell me the different kinds of testing that we're dealing with out there? There's a simple test that tells you, okay, has someone been exposed to it? Are they? But what is the difference between some of the testing that's out there and antibody testing? That's one of the questions that we have from an anonymous person right now.
So the test where they take the swab and put it up in your nose or in your in your mouth, in your oral pharynx, they're looking for the virus. The virus enters through the nose or through the mouth, and it makes its way down into the respiratory tract, deep into your lungs. And so that test is looking for the viral RNA. Now, in contrast, the blood tests that will become very common, they're looking for antibodies. So evidence that you have been infected with this virus. And it's through those antibody tests we're going to find out how many people were asymptomatically infected, never knew they had it. But they'll show evidence in the blood test of having antibodies against the virus. And of course, those are tremendously valuable antibodies to someone because it's likely that they'll provide you protection from this virus, at least for a period of time. In the case of SARS, those antibodies lasted for a good 2 years.
So I think that's a good point. We still don't know nearly enough about COVID-19, and there's a lot more to be studied in order to know whether there are groups out there that are just asymptomatic but not showing symptoms, and also whether there's hope for a vaccine and how long that vaccine will last. Is that fair?
Yes, I mean the natural immunity that one acquires with the infection. At least in the case of SARS, people who 90% of people who survived from SARS, they had protective antibodies, and the feeling was that the protective immunity lasted for about 2 years. But of course, that could be boosted. If we had a good vaccine, we could boost, just like we take a flu vaccine every year, we could take a coronavirus vaccine every year.
I think that leads us into your next slide perfectly.
Okay, next slide, please. So how did different countries handle this virus in the outbreak? As you know, China was hyper aggressive in their testing, and they quarantined like crazy. They quarantined cities of 11 million, like Wuhan. South Korea took a different approach. They did massive testing and contact tracing, and they were able to keep their society going. And they, probably the best model of a country controlling this virus through massive testing, the kind of the first arm of the public health intervention. So did Hong Kong, so did Singapore. In contrast, Italy, they kind of neglected the virus. They had limited testing. They were late to social distancing. And that country has been overwhelmed by this virus, as has been Spain. The United States, despite seeing that this was coming, we were delayed in terms of our testing, and we were delayed in terms of our distancing. We are, here in the United States, we are home to 30% of the world's infections, but only 4.2% of the world's population. And then we have great disparate infections in, for example, in New York versus San Francisco. Now, there's lots of reasons for that. New York was probably further up the exponential curve of viral spread than San Francisco when they went into a lockdown. But clearly, the informed leadership, the brave leadership of the leaders of the counties and cities in the Bay Area to lock down when they did. They were the first in the country to do so, has really, really benefited the Bay Area.
And Dr. Greene, that leads me into a debate that is happening out there, and we have several questions about this. How is this related to density? So just because a city happens to be dense and have lots of people, does that mean necessarily that the virus is going to spread quickly, or is it more based on behavior and the number of contacts that people have, so increasing the likelihood that they will come in contact with someone who is affected?
Well, certainly density is an issue, but for this virus to spread, you have to basically have an interaction with someone inside of 6 feet. So that the chances of such interactions, of course, increase with a high density population, like if you're on a bus or on a subway, et cetera, if you're on a plane. Again, it's not just passing in the on a sidewalk. It really is an interaction that's required for the virus to spread.
Okay, great. Let's move on to your next slide.
Yeah, thank you. All right, so just to give you an idea of where SARS stands in the spectrum of viruses, and along the x-axis here, you see this is the number of people that if, for example, if I was infected with measles, how many people would I spread the measles to? And this is amongst the most infectious viruses we've ever encountered. And the answer is 15. Chickenpox, as you see, is about 8. Polio looks 1, 2, 3, 3.5 people. Now, and on the y-axis is how lethal the virus is. And so you see the real bad actors: MERS and SARS and Spanish flu, Ebola, bird flu, smallpox. Those are the bad actors that have like over 9 to 10% and even higher mortalities. So where does SARS-CoV-2 fit in this? So we think that someone with SARS-CoV-2 will probably spread the virus between 2.2 to 3.5 individuals. We'll know better that numbers when the epidemiology gets a little better. And we think, I suspect, as I was saying, that the death rate ultimately will settle down to be around 1% once we know how many asymptomatic infections are occurring. For example, it could be that a lot of our kids are asymptomatically infected. And because this virus in general spares children in terms of serious disease.
Can you, does that relate to herd immunity at all?
So herd immunity goes back to those antibodies.
And I want to make sure that I give credit to this question about herd immunity. I have multiple questions, one from Walt and one from Dave. Thank you for those questions. I appreciate it. And sorry, Dr. Greene, go ahead.
Right. So herd immunity is a concept in vaccinology, and basically what it means is if as a population, if there's a significant number of people within the population who have antibody and resistance to a virus like SARS-CoV-2, then those of us who don't have immunity can hide within the herd. We can hide within the herd because it's harder for the virus to find us. The chances of the virus finding 2 people in the herd that aren't immune is less, so you hide out. That's what it's called, herd immunity. So we don't have to have 100% immunity within a population for protection because of this concept of herd immunity.
And so there's 2 ways for that. One would be if lots of people are getting a vaccine, and the other would be if lots of people have already been infected and then recovered from the infection?
Correct.
Excellent. Thank you so much, Dr. Greene. And thank you for those questions. Please keep them coming.
Let's go on to, I think, my last slide. What is Gladstone doing? So Gladstone is a research institute affiliated with the University of California, San Francisco. I, for about 28 years, directed the Virology and Immunology Institute, stepped down about 2 years ago, but continue to have a very active laboratory, which is now completely devoted to COVID-19 research. So on the next slide, just want to summarize a few of the things that we're doing. So this circle with the spikes on it, actually, can you see my pointer?
No. I cannot see your pointer, but
okay. So you see the virus that's trying to get into the cell.
Yes.
My own laboratory is working on ways to prevent that entry. And that virus has to fuse its membranes with the host membrane. So we're looking for fusion inhibitors. We're trying to nip this infection right at the get-go, to never let the virus get into the cell. Nevin Krogan and his colleagues have mapped every protein in the virus and its interaction with every host protein. And these maps are suggesting that there could be a variety of different drugs that are already FDA approved that might be able to fight against this virus, drugs we never knew about. Then the virus is made and it goes out of the cell. Lior Weinberger is working on a therapeutic interfering particle. It's like a viral mini-me that is able to steal all the essential nutrients and factors from the real virus, thereby preventing its replication. Jennifer Doudna and Melanie Ott are working on a diagnostic test using CRISPR technology. Jennifer Doudna was one of the discoverers of the CRISPR system. They're trying to work out a diagnostic test that would actually link up to your iPhone and could be an at-home type of testing. Melanie and myself, we're also working on the late stages of the disease. As you know, people who become really very ill with this disease, that often the mechanism of death is not the virus itself, but it is the host, an overzealous, an overly aggressive response of the host against the virus that leads to the acute respiratory distress syndrome and essentially an inability to oxygenate. So we're looking at ways to intercept that cytokine storm that leads to ARDS.
Would I be oversimplifying if I called that a pneumonia?
Yeah, but it's a pneumonia. It's a pneumonia that starts out caused by the virus, but it ends in a pneumonia and a death response that's caused by the host over responding to the virus.
And that's why ventilators are so important.
Right.
Can we go to the next line?
Yeah, I think that's it. Okay. What you can do right now. So I tell you, everyone in Northern California should feel proud, but now's the time to double down. Now's the time to really, really enforce our gains. So stay at home. If you're out, stay 6 feet from other people. If you're in public, wear a mask. The reason to wear a mask is you might be one of these asymptomatically infected people, and the mask will prevent you from spreading the virus to others. It might also, in some small way, help prevent you from acquiring the virus from others. Wash your hands for 20 seconds frequently. That, of all the things we do, hand sanitation is probably one of the very best things in keeping our hands off of our face. I think there's some studies suggested that normally you touch your face 27 times in an hour. I found myself trying to count the other day when I wanted my hand to go there. It was a lot. And you can also, now a very small chance of risk, but this does seem to be a sticky virus. It can survive on surfaces for longer periods of time than we anticipated. And so I certainly participate in decontaminating any items, like a doorknob in a public space. I treat as contaminated. I don't know how much virus is on there, maybe likely none, but I treat it as a contaminated. I will wash my hands immediately, et cetera, et cetera. And you can think about doing the same things with anything that comes from the outside of your home into your home, trying to minimize the chances of infection.
Including food, right, Dr. Greene?
Yes.
That's actually one of the questions that we received from, I lost it. One of the questions we had was definitely about decontaminating food that comes into the home. How important is it, and how do you do it?
Okay, so I think that the chances of you getting the virus from a contaminated surface are small, but this is something that you can really, really deal with. You can make it essentially almost zero by decontaminating surfaces, by decontaminating, for example, the cereal box. You can do that with a Lysol wipe or a Clorox wipe, or these kinds of alcohol. Essentially, 70% alcohol will dissolve the membrane of the virus, take the lipid out of the virus, and it will absolutely kill it. Another way of doing it is just to take household bleach and dilute it 1 to 20 no, I'm sorry. You want a 2% solution of bleach, so 1 to 50 dilution of the bleach, and then you can use that as a disinfectant.
Dr. Greene, thank you so much. I'm sure that we're going to have more questions for you. I do want to go on to the next slide. And this is our local data. So this is data available to everyone that you can get at the San Mateo County website. And part of what it's showing you is our dashboard of information that the county makes available every single day. You can see that it's up to date right up to April 12th there, and we'll be getting new data tomorrow, I'm sure. It doesn't look like we've peaked yet. We still see the numbers going up, but we hope that we are close to peaking. And again, this is information that you can get at smchealth.org/coronavirus or smcgov.org/coronavirus. You can see that our deaths are at 21, and there's also lots of other great information that's available on the county website. If we could go to the next slide. As Dr. Greene mentioned, we are not the gray curve. We actually implemented the social distancing early on, and so we avoided that very steep peak. We even avoided that yellow peak, and what the county is projecting in their models at this point is that we hopefully are going to be as close to that blue line as possible, because we've really limited social contact. The social distancing is working. And what's obvious from this chart is that because we're social distancing, because the peak doesn't come right away very quickly, our peak comes later. And so we may be social distancing for a longer period of time, but it's clear, Dr. Greene, from what you mentioned, that until we have the infrastructure in place for tracing, for contact tracing, and for the elevated testing, not just testing people who are symptomatic, but people who are asymptomatic, so that we actually know the number of people in the community who have been exposed and who have the virus. It'll be very difficult to open up the county again. If we could go to the next slide. Because of everything that we're doing, all of our efforts and social distancing and keeping people home, many people have lost their jobs. And we know that the economic impact to people's lives is very significant, and for many people, it is critical for them. And so I'm glad that we have Senator Hill here to talk to us about how we're dealing with that at the state and county level. How are we dealing with all those folks who are unemployed and helping them to pay the bills, to put food on the table, and to make up for those paychecks that they're not receiving. Senator Hill?
Well, thank you, Mayor, and it's wonderful to be with you, and I enjoyed Dr. Greene's presentation. It was quite enlightening for sure, but so many of us, 3 million in California now, are unemployed, and so many of those who are watching and listening today are unemployed, sitting at home and waiting for that check that's coming. It's in the mail in some form. But if you've been out of work for now about 3 weeks, your check, and you've applied about 3 weeks ago, you should be getting that first check. That first check will probably be, if you get the maximum $450 from California, and they have waived that first week. So usually you have to wait a week. Now you do not have to wait a week, and you're eligible from the first day. So that check should be coming. They're only looking at a couple of things as a criteria. One is whether you have the wages that you've earned over the period of time that you've historically, and two, if you are the person who is applying. Those are the only two criteria looked at. They're not looking and requiring you to look for work. They're not requiring you to get a response from your employer before they send the check out. Now, what has happened this weekend is the federal extra $600, the pandemic relief, the CARES Act that the federal government passed, that $600 will be on top of that $450. Those checks went out a couple of days ago. Actually, yesterday were the first checks to a few 100,000 of those people who have applied earlier. That's on top of the $450. So you will be getting about $1,050 is the maximum you could receive for up till the end of July. The amount for the $450 could go all the way for 39 months. It used to be 39 weeks, used to be 26 weeks. So that's a considerable amount. Your check also, it's retroactive from the federal government. So that $600 that you'll be getting, the first check from the state will be for $1,200 on top of your $450. So you'll probably get around $2,000 if you'll get the maximum. And then there will be another check coming from the time that the act passed, which was a month or so ago. So there's a good opportunity there if you can just hold out a little longer. For those people who are self-employed or gig workers or independent contractors, the state is now implementing the guidance that the federal government gave, and that also is and can be $600 per week per individual. The problem that we're encountering is that the guidelines are not established yet. It's going to take another 2 weeks, unfortunately, for that to be implemented. But when it is, when you apply, you'll get the check within 24 to 48 hours. So there's a quick ramp up time for that. So it's working properly. The problem that many people are having is going on picking up the phone and calling. If you have to do that right now, it's a struggle because the offices are only open for 4 hours a day. That's the way they've been since 2013 when the unemployment rate dropped so low. That will change next week. They'll be open all day. People will be able to get their answers to the questions. The other part that's difficult is if you have a problem with your unemployment. So fill out those forms, meaning if there's a unique circumstance that you have. So the more you can do online, the quicker you can get the response, the quicker you can get your check. And that should be done. Also, there'll be frequently asked questions. The FAQs will be out in the next day or so. That will give you a lot of crucial information, especially on those independent contractors, the gig economy, and self-employed people. So things are moving forward fast, but you can imagine with 3 million applicants, when you're used to a lot less than that in a full year, it's been a challenge. So hopefully that money will be out and they'll be able to get it real quick.
Senator Hill, you anticipated my question, which was about self-employed and gig workers. We got a question from Audrey who was asking exactly that. So she appreciates the work that you and your committee are doing in order to implement that and also extending it even further, making it retroactive to the time when people lost their jobs. It's so critical to keeping a roof over people's heads, keeping food on the table. It's all we can do right now. And so thank you for all of the work that you are doing and continue to do. I appreciate it very much.
Thank you, Mayor. Appreciate it as well.
I want to kick it over to Assemblymember Mullen. I believe everyone at home can see the pictures from Senator Hill and Assemblymember Mullen and Assemblymember Berman and Assemblymember Ting volunteering at Samaritan House on Monday, doing a great job. Jerry, it looks like you were filling up trunk after trunk after trunk full of groceries, keeping people fed, and that's amazing work. Assemblymember Mullen, give us an update on how things are going over on the other side of the Capitol building.
Excellent. Well, thank you, Mayor Goethals, for your leadership in making sure your San Mateo County constituents are staying connected to the latest information. And thank you, Senator Hill, for your legislative partnership. Yes, we were out at Samaritan House. We were pulled together by Congresswoman Jackie Spear. I want to make sure we give her a shout out. She gathered her state legislative colleagues to spend the afternoon. And I know Bart Charlo with Samaritan House is coming up in just a bit, but wanted to give a little bit of state information in addition to what Senator Hill reported out. Governor Newsom gave his update today regarding gradually reopening the economy, and he's made it very clear that this is a decision that's going to be based on science and not political pressure. He identified 6 indicators for modifying the stay-at-home order that we are all operating under. And those 6 factors and indicators that the governor's office will be reviewing are the ability to monitor and protect our communities through testing, contact tracing, isolating, and supporting those who are COVID positive or exposed to the virus. The ability to prevent infection in people who are at risk for more severe COVID-19, the ability of the hospital and health systems to handle surges, the ability to develop therapeutics to meet the demand, and the ability for businesses, schools, and childcare facilities to support physical distancing. as well as finally the ability to determine when to reinstitute certain measures, such as the stay-at-home orders, if necessary. So some folks were hoping that the governor was going to actually issue a specific timeline. He is resisting that, but wanted to at least share with the public what the thinking is in terms of when we may gradually reopen portions of the economy, if you will, for lack of a better terminology there. And Joe, while I have the floor, just a couple of other state notes. Yesterday it was announced that the insurance commissioner, the state insurance commissioner, Ricardo Lara, is asking for a rollback of insurance premiums. This includes personal auto, commercial, automobile insurance, workers' compensation insurance, commercial, multiple. I'm going to scratch that one. I'm not sure what that category is, but it's commercial liability insurance and medical malpractice insurance as well. So that just came down yesterday. And if our legislative colleague, Mr. Berman, were on the call, he would be talking about the census. He is leading our efforts in the assembly on the census. We are learning that California, which is historically the most difficult to count state in the country, is actually slightly above the national average on its response rate. And San Mateo County is 10 points higher than the statewide rate. So kudos to everyone who has done their part in that regard. And if you haven't thus far, you may fill out the census at 2020census.gov. Senator Hill talked extensively about the unemployment situation. Our Assembly caucus today was briefed by the Labor Commissioner of California. The 2.8 million unemployment claims is unprecedented. And that office and the Employment Development Department are grappling with the volume of applications. The impacts will be felt for months from this economic contraction. I wanted to plug a website, onwardca.org. Onwardca.org has information for job openings throughout the state for individuals who have lost their job as a result of COVID-19, including a dynamic matching system. So I would encourage those on the call, should you have been displaced by this economic contraction, to look at that site. And also, if you have trouble navigating the Employment Development Department, the EDD site, the best way to reach my office is to simply Google Kevin Mullen, and you may fill out a simple online form on the official website for my staff to follow up with. And the same, I know, goes for Senator Hill. And just finally, Joe, I'll wrap up with a note of gratitude for the leadership of our county officials. Their aggressive stay-at-home actions are bearing fruit in bending the curve, as you heard the doctor indicate. This region is setting the tone for the state and the nation on how to aggressively take action to save lives. So not only as a public official, but as a resident of San Mateo County, I am very grateful for that. So with that, I'll turn it back to the mayor.
Thank you so much, Assemblymember Mullen, and thank you for the shout out for the census. I will point out to all San Mateo residents who are listening that Belmont has pulled ahead of us in the response rate. And so now is the time to go to your computer and fill out the census right now. You cannot allow Belmont to pull ahead of us in the response rate. Don't let that happen. And Kevin and Jerry, both of you, thank you for all the work you're doing. You thanked the first responders, the people who are on the ground in the hospital, the county leaders who are making sure that our response is sufficient. But we're going to be even more reliant on the two of you going forward in Sacramento in order to recover economically from all of this. Putting money in people's bank accounts so that they can put food on the table and keep a roof over their head is so critical. And I know even the cities and counties, we're going to need to be able to recover from this. And so your help in getting us to recover the dollars that we're spending to combat this virus. I know that there'll be federal dollars available at some point, and I appreciate both of you for helping us to do that. Obviously, Congresswoman Jackie Spear is a huge help in that regard as well. So thank you to you both. I want to transition to the CEO of Sita. As we mentioned, many people are out of work. But who is it that employs all those people who are losing their jobs at small businesses? And to the extent that we can save our small businesses, we can keep so many people employed and recover from this much faster. How do we do that, Roseanne? I want to turn it over to Roseanne Faust, the CEO of Sita. Roseanne, how do we do that? How do we keep our small businesses employed? How do we keep those jobs available for folks?
Thank you, Mayor Goethals. Thank you to everyone on the call, and thank you for just everyone, because we are all pulling together in this. San Mateo County is such a unique place. I want to go through a set of slides very quickly. So Sita is an organization that has been around in San Mateo County since 1953. If we go to the next slide, we will show you how quickly Sita pivoted at the beginning of March, when we were attached to the county manager's office as the liaison for the business community and their emergency operations center. We started building resources immediately through samcita.org. It started with general information on COVID-19, and it quickly flipped to business and financial assistance program. We launched a business economic impact survey. I'll give you the numbers for the city of San Mateo shortly. We also facilitated the design, development, and launch of the San Mateo County Strong Fund through the back end of the Silicon Valley Community Foundation. If you go to San Mateo County Strong, you will see a number of PSAs. We are doing multilingual messaging. We are raising dollars every single day. The County of San Mateo committed $3 million initially, $2 million for individuals and families and nonprofits, our core service agency, including Samaritan House right at the front end. There is $1 million for small business. We also worked with all of our 21 different jurisdictions. There are 20 cities in San Mateo County, plus the county, our chambers of commerce, our trade associations, our nonprofits, and pretty much everyone else. If we go to the next slide, our business resource page, I would really point you to the business continuity action plan up in the upper right corner. We are on version 4 of that, which will launch tomorrow, and it level sets for the business community what you can do individually as a small business, and then what resources are currently available to you. Thank you for Assembly Member Mullins' shout out on Onward California, because we took their information from a few weeks ago, plug that into jobs for hire. That's in the yellow links to the right. You will also have information from NOVA, which is our workforce investment board for San Mateo County. There is a whole listing of job opportunities. We also have educational resources. We've had about 30,000 page views since March. And quickly moving on to the next slide. Here is our business economic impact survey. We've received over 1,138 responses thus far. If you look at the number for the city of San Mateo, it is at, let's see, San Mateo is at 197 responses. The first group of responses went to the city of San Mateo about a week and a half ago. Their city staff, I want to commend them. They have been working in contacting the small businesses and seeing how best that they can support their small businesses during this. Do they need technical assistance? Do they need help filling out forms? What exactly is needed? If you move on to the next slide, this talks about the San Mateo County Strong Fund. Again, all of the dollars raised through the San Mateo County Strong Fund will stay in San Mateo County, and it'll serve 3 purposes: individuals and families, nonprofits, core service agencies, and small business. The dollars that have been raised so far through the Community Foundation as of yesterday, 689 individual donations to the tune of $255,000. This does not include some of the larger pledges to date: $1 million from Gilead, $50,000 from Google, $25,000 from Comcast, and then you see Franklin Templeton in the city of San Mateo made an initial contribution of $10,000. So we are going to continue to raise money, because when you think about $1 million, and if we're looking at small business grants up to $10,000 in cash, that helps 100 small businesses across 21 different municipalities. So we need to raise a significant amount of money in addition.
Roseanne?
Yes.
So that's incredible. These numbers are just amazing, and I appreciate all the money that's being raised. Do donors have the ability to choose what their money goes towards?
Yes, they do. They can choose it either through the Silicon Valley Community Foundation. When you click on PayPal, you have It can be general, or it can be one of the 3 buckets. The other thing, I set my timer, so
no problem. You're doing a great job. I actually have another question here for you from one of the people out in the audience, and that is this one of those programs where it's going to have an extensive application? Are people going to have to show lots of documentation in order to apply for funding?
So with the Small Business Assistant Grant, we are actually using San Mateo Credit Union as our local partner, because there was no mechanism that could really get the money out quickly. So we have criteria that will go before the Board of Supervisors next Tuesday, an extensive marketing campaign. The credit union is able to do an online application and quickly look at a business's paperwork. So there'll be some things that, yes, a business has to submit, because we're very conscious of any fraud. But it's not going to be extensive. It's going to be, they'll look at it, they'll say, yes, all the boxes are checked, and we want to get checks out the door.
And put it in the hands of the people who need it without excluding folks by making it too difficult to apply. Is that what you're saying?
Yes,
excellent.
Exactly. And then the Business Continuity Action Plan, again, lots of links. That was the next slide. And I flipped to slide 8, which we are collecting data on all the different financial assistance programs that are available on the local, state, and federal level. So we have links, also private sector. What business grants are Facebook doing? Verizon, Salesforce. What is coming down the pike from the federal government? I know there's been a lot of issues with the Paycheck Protection Program. We are trying to unwind that with our congressional delegation, as well as with the SBA. So that's it on my part. Tried to talk as quick as I could.
You are wonderful, Roseanne. I appreciate your help so much. You have done such a great job of setting up a resource for all small businesses, and really for anyone. I would encourage anybody who's concerned with unemployment insurance or small business loans, or any of the ways that the federal and state government are trying to keep our businesses open, trying to keep people employed. Go to the SamCita website. It will help you. Go to the San Mateo County Strong website. Thank you for being such an outstanding advocate and resource, Roseanne. I really appreciate it. If we could go to the next slide. Here we see our fearless county manager, Mike Halligy, was ahead of the curve and making sure that we had the hospital beds we needed in case we saw a huge surge that overwhelmed our healthcare system. So we are prepared. We've got the ventilators that we need. We haven't seen our healthcare system overrun yet. San Mateo, Foster City, and Belmont opened up a joint emergency operations center at the San Mateo Police Department. You can see a photo of that. We've been working together to make sure that our response is coordinated. Police and fire, all of our first responders are still working. I'm going to give our police chief and fire chief an opportunity to talk to that in a moment. But we're doing well in terms of PPE, and of course we have childcare set up to support those first responders. Looking at our next slide, so Samaritan House is one of our amazing partners. Samaritan House is the nonprofit that I look to whenever we're in a crisis, because they serve more people and they do an incredible job at doing that. And for that reason, I've invited their CEO, Bart Charlo, to join us today. And I've really got 3 questions for you, Bart. It comes down to number 1, what are the services that Samaritan House provides?
Well, on an ordinary day, Joe, what we would provide is everything that people who are living at a low income level need to survive and then thrive. So it's food, shelter, clothing, healthcare, financial empowerment and assistance services, and services in the schools as well. So there's a lot of that goes on, but we're not in an ordinary day. So what
how have your services changed over the last few weeks?
Well, that's the key. What we've had to do is shift all of our emphasis into the most urgent essential services that we do, which is healthcare, food, and the financial assistance that allows people to be sheltered, as well as operating a shelter. So right now, if you need food assistance, if your household can't get that, you can come to Samaritan House in a variety of ways, and the food is handled safely. It's delivered in a safe manner, individually packaged. So whether you get pantry foods that your family could store and cook at home, or whether you get a hot meal out of our lovely kitchen, all of it would be safely packaged and given to you. So people are driving up right now. Every service that we have for food is a drive-up operation. We had, until COVID, our dining room that was 5 evenings a week in downtown San Mateo. If you drive up there now, obviously you can't sit down with a group of people. So what we do is we'll give you an individually packaged meal for each person in your house. You take it home and eat it. Hot, wonderful food provided, really thanks to our partnership with the food bank and all of your local grocery stores and all of our volunteers. If you come up to headquarters and sign up, there's food, pantry food, hot food, and we have a variety of ways of getting that out to people. Our food pharmacies for people who are diabetics are operating in both of our clinics. The one in San Mateo on 39th Avenue is doing fine with that. Again, it's a drive-up kind of operation so that you don't have to risk a lot of personal contact.
People who are coming for food, do they even get out of their cars?
No, they do not, unless they're not in a car and have to come up on public transit, which they can do too. But the line, Joe, the line was down the block, and it's just astonishing. We are adding, just for food alone, at a rate of 250 new additional households per week. So you start accumulating that, you realize how massive the demand is, and we're really just at the beginning. We also,
sorry, Bart, we at the City of San Mateo are looking at our bottom line and understanding that our budget is significantly affected by this. I would imagine that you're seeing that much demand at Samaritan House is really putting a strain on your resources, I would imagine.
It is. We do have enough food. I want to emphasize that. But yes, we've had to put on actually extra staffing to handle the load of getting out financial assistance to households so that they don't lose their home, so that they don't get, so that they can pay the utility bills and all of those things that are essential to keeping from becoming homeless. So it's a big job, and mostly we work with volunteers, but it took a little extra staff to pull us off. And this is at an odd time for us because actually we had to postpone our one fundraising event a year. But if you let me do a plug.
We're doing it April 30th on my birthday. On my
Online.
birthday, I will be there, Bart. Trust me, I will be there. I'm already raising money for you, and I will see you on April 30th for your virtual gala. The main event is the biggest deal of the year. I've seen our Senator Jerry Hill has been the MC and auctioneer many times, and we are all so proud to participate. Earlier, we saw that photograph that had Assemblymember Mullen, Assemblymember Berman, Assemblymember Ting, Senator Hill, and of course, Congresswoman Jackie Spear, all participating and supporting you on Monday. So we will all be there for you on April 30th for the virtual gala for the main event. Of course, we will be there for you, Bart. Any other details about it that you want to mention?
We're inviting the public. Anyone can come. The ticket is, all you got to do is sign in. So you can be right there.
Donate some money. Donate some money. That's the pitch. So, of course, you can sign up to volunteer. You see the website right there. You can be a volunteer. Anyone can help with food, but the money is so important right now. Keep them in business, helping other people. It's the most direct way to help anyone during this crisis. Bart,
let me offer one thing, and I think this is very important because the San Mateo community has been extraordinarily wonderful in volunteering. People are saying, what can I do? Let me do something to help. And we do run on volunteers, but I do ask people to be patient because we have to process an awful lot of people through volunteering for an awful lot of jobs that are constant throughout the week. So if you do volunteer and sign up at our website, be patient with us. We'll get to you. We love you for doing it.
Bart, thank you so much. We will all see you on April 30th for the virtual gala. Thank you for all you do. Keep doing it. As we move on, I'm going to get to the chiefs right now, but we did have a question about specific city resources with regards to our businesses, especially downtown. And if you go to cityofsanmateo.org, you will see resources just like Roseanne Faust has on Sam Sita. And in many ways, they are the same, but if you're looking for specific information in the city of San Mateo, you can go to our website. Now I'm going to kick it over to our chiefs. I'm going to talk to Chief Barberini first, our new police chief. Chief, I want to ask, during these critical time, how are you managing our first responders? What are we seeing out there? Are we able to keep everyone calm during these tough days?
Well, thank you, Mr. Mayor. And before I begin, I'd really like to extend our gratitude and appreciation for the San Mateo community and our residents. We've really seen the city take the existing order to heart, take it seriously, and the level of compliance is extraordinary. And even when our officers are out in the field talking to people or trying to educate folks about what the order means and what it states, the reception that we've gotten has been overwhelmingly positive. That's a tribute to the community and the progress that we're making. I will be very brief, and I will talk to you a little bit about what our approach is and what we're seeing out there on a day-to-day basis. As this order developed, within the first 24 hours, the police department identified a full-time 3-person safety team with the emphasis on maintaining a workforce that could continue to provide public safety services. This team has been very successful in ensuring best practices and in many cases developing best practices on how to keep our first responders safe and prepared to respond to the needs of the community. That's included everything from examining our building and how we can limit access to the building, providing decontamination sites for folks who are coming inside and out, and providing adequate PPE, which you had mentioned, which has been essential and very important. As a result, we've seen no impact on our ability to provide law enforcement services due to staffing issues. So we're very grateful for that. Initially, when the order first came out, we took an approach the first few days of a heavy presence, a police presence in the community, just because we understood and we realized that there may be some apprehension or some concern within the community about what the order meant and what its impact would have, and how people would respond or react to that. Again, we're very encouraged. Our city came through with flying colors and responded in a calm manner.
Let me ask you about that, Chief, because we have a question here about, are we seeing hoarding? Is the police being sent out to the grocery stores in order to prevent people from emptying the shelves, essentially?
So we can't prevent people from doing that legally. There's no order that allows us to do that. We were worried about some those types of incidents early on. We didn't see panic. We did see, obviously, we see the lines at the grocery stores now, but we didn't see the sense of panic that we were concerned with after the first few days. So I guess to answer your question, we're seeing the same thing that everybody else is seeing, but we're not seeing it at a level that has risen to something you would see during a natural disaster or something like that. I think that our residents and our community has shown strong composure and for the most part has done what they can to further the cause.
I have a lot of questions here about perhaps seeing an uptick in domestic violence and hate crimes. Are you seeing that, and are you prepared for it?
Well, overall calls for service are down. We've seen about a 20% decrease in regular day-to-day calls for service. The one area that we've seen an uptick is not necessarily domestic violence, although it may be domestic violence related, is disturbances within the home, whether they be arguments or some type of disagreement. Most of those calls call for our interaction. Fortunately, most of the time we act as mitigators, there to keep the peace. But we understand that people in their homes for prolonged period of times, things can happen, and we still take domestic violence extremely seriously. That we take a zero tolerance approach. It will not be tolerated in the community, and why we are seeing an uptick in those types of disturbances where we're called out to homes to kind of mitigate or mediate in certain circumstances. We're very sensitive and very conscious about domestic violence and continue to monitor that closely.
I really appreciate I really appreciate the messaging that the police has put out there, both regarding domestic violence and about any kind of racial hatred during this time. So please keep up that amazing work. I think we may have more questions for you in a minute. I do want to get to Chief Iverson, and we are into bonus time. So I'm going to speed us up a little bit. I'm going to run through as many questions in a lightning round as we can for everyone. But first, I want to give Chief Iverson a chance to talk about what he's seeing with San Mateo Consolidated. As many people know, San Mateo, Foster City, and Belmont consolidated their fire services over the last year. It was a 3 or 4 year process. It is going very well, and our new Chief Iverson is overseeing it. Chief, what are you seeing on the fire side? How are our first responders doing? Chief, start over now that you're unmuted. Go ahead.
Okay. Thank you, Mr. Mayor. Thank you, everyone who's listening and those on the panel. Wanted to let you know that we're continuing to do our part. SMC Fire, San Mateo Consolidated Fires, maintain our state of readiness. We're doing everything we can to minimize the effects of the pandemic on our members and the community. We very early on instituted our incident action plan. We have contingency plans. We're prepared to deal with pandemics. We have made adapting adjustments to fit this situation. We've been working with our EOC in San Mateo, with all 3 cities, a joint EOC operation. We've been working with the county EOC. We have representatives there that are staffing that operation daily. We have worked with our county partners, and we have contingency plans, and we're happy to report that all of our crews are ready and able to serve. And we want to remind the public, we do have an uptick in calls. We're at about 10% below normal. When we started this pandemic, we were 30% below normal. So we're seeing a rise in calls and activity. So we want to remind the community to continue to do their part by staying at home. We're here for you, and we'll be prepared to respond if you need us to for emergent calls. We're going to get through this process together, but we need everyone to do their part. We like to remind the public to also do their part, and they have been doing their part for the most part, because the public, they're the real heroes. They're the ones who are making the sacrifices, staying at home and sheltering in place. And we appreciate that, the sacrifices that you've made. And as we get through this pandemic together as a community, it's going to take all of us working together.
Chief Iverson, that's a great message. I really appreciate that. It's been weighing on me heavily thinking about our first responders. All of us have seen New York. It's over 10 police officers with New York City PD who have passed away from COVID already. There are too many first responders out there on the front lines who are being affected by this. And so I want you to know we're thinking about you, and continue to get tested. I believe we've changed the county protocol so that all first responders have access to tests if they need them for any reason. Please keep up all the hard work and let us know if there's any additional support you need. But I think for the moment, you have the personal protective equipment, and the message is just tell people to stay home. That's what they can do to help you, right?
That's correct. Staying at home helps all of us. Helps none of us reduce exposures. All of us reduce exposures in contact. And our thing is about minimizing that contact, minimizing the risk of exposure. The more we stay at home, the more we contain it, the better off we'll all be.
Thank you so much, Chief Iverson. I want to mention a couple things before we get into the lightning round. And the first one is there are some hard truths, some realities that we all have to deal with. And that is that there are people suffering right now. There are people who are sick. There are people who are isolated. There are people who have lost their jobs. And our thoughts are with all of them. We know how hard this is, and we're trying to do it together. We know that we're all in this together. We are going to see more people get infected. We are going to see more people get sick. We are going to see the death toll go up, and we're doing everything we can, and we can't stop now. Now is not the time to walk away from this. We've got to double down on our efforts. We know how hard it is. I guarantee you think about your leaders, you think about your first responders, our families are affected too. Our families are feeling the pain, and it is extremely hard. We've all lost loved ones during this time, and we're not getting a chance to mourn because we can't be together. And we all look forward to that day when we can be together once again. On the lighter side of things, I was reminded that the Giants are undefeated so far this season. Thank you for that, Bart. Thank you. I knew I would get you with that one, Bart. We have a lot. We have a lot to be hopeful for. As we heard from Dr. Greene, there are many, many smart people working extremely hard to make sure that we have a vaccine, to make sure that we have treatments, to make sure that we are doing all the testing and tracing that needs to be done in order to protect all of us. And we want to open up the city again. We want things to go back to normal or as much as they can. But we can't do that until we have the infrastructure in place to do the testing and the tracing and the treatment. And a year from now, I guarantee you things will be better. We will have a vaccine, we will have more testing, we will have more tracing, and we will be dealing with our economic conditions with the help of people like Roseanne, with the help of people like Senator Hill and Assemblymember Mullen. And in the meantime, we all need to do what we can to help those among us who are in the most need right now. And that means supporting Bart Charlo and his whole team at Samaritan House. What you can see on your screen right now are all of the resources that can help you the most by staying informed, by donating, by volunteering. If you all can stay with me for about 10 more minutes, I want to run through these. This is the lightning round. There's a request here that next time we deal more with special business. So small businesses could have their own town hall, and we may do that in the future. And Roseanne, I may be inviting you back just to help out small businesses. As seniors sometimes have a hard time with grocery stores and helping out. I'll mention two things that we're doing locally for seniors. One, the grocery stores are opening up that first hour for just seniors, so it's a little bit easier to keep social distancing in the store. Number two, Chief Iverson with the fire department has activated our CERT program. So we have trained volunteers who are wearing personal protective equipment and delivering meals to seniors in the safest possible ways. There's 6 or 7 different programs that are delivering meals to seniors' homes, and we didn't have time to get into all of them, but thank you. If you want to volunteer, please sign up on our volunteer page. Let's see. Again, I'm going to go as quickly as possible. Dr. Greene, can you remind us, should people be wearing masks at all times, and why are they wearing masks?
Yes, so the recommendation now is that people wear masks in public. But they're really doing that primarily to protect other people in the case that you're asymptomatically infected.
I should feel good about wearing my mask at the grocery store because I'm actually trying to help somebody else in case I'm an asymptomatic person.
Correct.
Got it. Bart, there's a question here about whether Samaritan House is still accepting food donations.
Well, right now we can only accept food that has been commercially packaged or comes from an FDA certified restaurant, for example. That's for your protection, for the protection of everybody we distribute it to. So later on, after this crisis, we'll accept anything, but right now we got to be safe.
Don't bring your groceries in your trunk and try to drop them off. Send cash. Send cash. Okay. We're going to go through as quickly as we can. There were multiple people who wanted to know about the donations. There's another request here for another town hall based just for the small businesses. So I may be calling you, Roseanne. We can reach out to them and help them out. There's a question. There's a question about why are we keeping the farmers markets open. Farmers markets qualify just like grocery stores as food distribution, and so because they are serving that critical need, that essential need of helping people with food, they can stay open, but we're doing our best to enforce social distancing at places like farmers markets. Dr. Greene, I want to ask you about comorbidity. So there's been a discussion publicly, and I think it's true that the same way we see comorbidity between other diseases, we see it here with COVID-19, and so this disease is affecting certain populations more than others. Do you want to expand on that?
Sure. This virus primarily infects the lung, the epithelium in the lung, but it also infects the heart and it also infects the intestines. So you can see different comorbidities coming as a result of what particular tissue or organ the virus infects. But then on top of that is a whole series of other medical ailments that make you, for example, smoking. If you smoke, you're at greater, or you have asthma, you're at greater risk for problems when it attacks the lung.
Thank you very much for that answer. I had one. So there's a question here about how bad is it going to get? You earlier estimated that we're hoping that the mortality rate will be below 1%. We've got over 350 million people in this country. 1% could be 3 million. Can you tell me that it's going to be less than 3 million people?
I don't know. Yes, I think it will be less than 3 million deaths in this country for sure. Are you talking about infections or death?
So death. So if the entire country got infected and 1% of us died, that would be over 3 million people. That's part of the thing that I think scares us all so much, is seeing numbers like that. We certainly hope that there's a significant portion of the population that won't get infected and that we'll be able to get this disease under control within a year so that we keep the mortality rate down. Is that something that you think we can do? You're
absolutely right. That if we just let this virus wash over the country, there would be millions of people dead. The Imperial College estimated worldwide, our population worldwide, something like 7.7 billion people, that 7 billion of the 7.7 billion would have become infected, highly infectious virus, and that 40 million would have died. That's Spanish flu type numbers. That's why the social mitigation that we're doing now is so darn important. But science, this is going to be a triumph of science. Science is going to deliver antivirals and it's going to deliver a vaccine. We will get through this if we can do our part to give scientists enough time to develop these tools that will end this problem.
Thank you so much for spinning that into a positive. And I agree that the scientific community is doing what they can, and never before have we relied so heavily on them, because we've never had a disease that was this contagious and this deadly. So as Dr. Fauci said, it's not going to be on our timeline. We can't open up the country when we want to. It's going to be on the virus's timeline. And when we have the infrastructure in place, then we'll be able to do that. Thank you so much. I think, honestly, I think that might be the positive message to end this town hall on, is that the scientific community is working really hard for us. And if we do our part and continue to do the social distancing, we will flatten the curve and we'll do everything we can. There will be more opportunities to have forums like this, and I will make sure that we're spreading information as widely as we can. There's a lot of questions that I tried to get to but couldn't. I do want you to know that for those of you who asked about renter protections, the small business commercial eviction moratorium is available on the city website. The residential eviction moratorium is on the county website. We're doing everything we can to help renters. We just last night agreed to a program where we're going to provide, I believe it was $400,000 in renter assistance. So we're going to do everything we can during this time to keep a roof over people's heads. Bart and the good people at Samaritan House are going to try to keep people's bellies full and do everything we can. I want to end on that positive note. I want to thank each one of the people who joined me today. I want to thank Bart from Samaritan House and Roseanne from Sita. Dr. Greene, thank you so much, from the Gladstone Institute. Chief Barberini, Chief Iverson, Senator Hill, Assemblymember Mullen, everyone who is here with me today, thank you so much. I want to remind everybody, stay healthy. Not just physically healthy, stay mentally healthy. That's one of the biggest things that we need to pay attention to during this crisis, is take care of our mental health and all those you live with and all those you care about. Now is the time to call your mom. Now is the time to call your cousin. Now is the time to reach out to those people who you love. Stay home. That's the number one thing you can do. Stay home, wash your hands, wear a mask when you go out. And lastly, be positive, stay positive. We're not going to get through this unless we do it together. I love you all so much. Thank you all for being with me, and perhaps we'll do it again sometime. Thanks, everybody.